Live from Moscow, this is RT with me, Rory Souchet. The UK's national healthcare system has been flooded with a wave of public anger. This after a recent scandal exposed negligence and the abuse of patients at a major hospital. And the findings of a specially commissioned investigation which details these issues of hundreds of people dying in appalling conditions will be laid before Parliament. As RT's Polly Boyko reports, claims of the ruthless mistreatment of those in need are increasingly being heard and echoing all across the country.
I lost my wife in Stafford Hospital in September 2008. It was just a disaster. It was just total chaos. When you walked through the doors of the ward, you could smell it. People shouting and crying, no staff available, you couldn't find a nurse. The buzzer was left out of reach. I went in once and she was on the floor. She'd been there since breakfast time, and she'd be lying her own feces. Medication wasn't given to her.
The death of John's wife is just one of the many horror stories to emerge from the now notorious Stafford Hospital. Relatives say it was a lack of compassion on behalf of the staff that stripped many sick people of their dignity.
Some were evil. That's the only word I can describe. They were nasty. My mum died in the most horrible circumstances that no human being should have to go through what she went through.
Julie Bailey's mother died at Stafford in what she calls appalling circumstances. But when she blew the whistle on the hospital's practices, she was faced with a cover-up.
All the evidence was there that the hospital mid-staffs was failing, and yet that was never shared with the public. And I believe the same as in other hospitals.
It's emerged that a string of senior officials failed to take seriously data which showed the hospital's significantly higher than average death rates. Relatives of over 1,000 people never got to see them discharged from this hospital. Patients died needlessly after suffering a catalogue of neglect, left in their own excrement, dehydrated and without painkillers. It's the biggest scandal to have hit the National Health Service in recent years. But with budgets being slashed and red tape preoccupying the hospital managers, Britain's health secretary is warning that there are little bits of Stafford dotted all across the UK's health system. The results of the public inquiry into the hospital's failings are expected to issue a damning verdict on the way the whole of the NHS functions.
It's soul destroying. If there's a bit of Stafford everywhere, then we've got to make safe. You know, it's got to be made safe tomorrow because people can't continue to suffer.
But even with the glare of a public inquiry and the media spotlight, it hasn't stopped. Last month it emerged that a 4-month-old baby being treated for breathing problems was found with a dummy taped to his mouth to keep him quiet. The nurse being investigated for the incident is the third member of Stafford staff to be disciplined in the last 6 months. The hospital's chief executive has said, "We're sorry that despite the progress that has been made, there are still some instances of care which fall below that which we want to provide." Sorry might be too late. With the tide of public anger swelling, campaigners say it's time for Westminster to overhaul Britain's beleaguered health service before any more lives are needlessly lost. Polly Boyko, RT, Stafford.
The Iranian President Mahmoud Ahmadinejad has called for the formation of a strategic alliance with